Thank you for joining me on Legislative Update. I'm your State Representative, Norm Johnson. In the past 5 years, more than 120 children have died under the watch of the State Department of Social and Health Services. Hundreds more have suffered abuse and neglect. A Seattle Times investigation also discovered senior citizens who are also supposedly to be under the care of DSHS suffering in tremendous pain, neglect, and abuse. These people are our state's most vulnerable. They must rely on someone else for their care. But when more than 16 children a year are dying under DSHS's care, and that's more than one child per month who was beaten, tortured, starved, molested, raped, and murdered, something is terribly wrong. The Department of Social and Health Services has become the state's largest agency, with a budget exceeding $20 billion and more than 19,000 employees. I want to make it clear that we have some very good frontline workers at DSHS. They are not the problem. The problem stems from layers of bureaucracy, combined with entrenched management systems. Many good DSHS workers are frustrated with what they recognize as a broken system. They say they work for an agency within another agency. Each agency has inconsistent rules, managed under different entrenched fiefdoms. Each one of these agencies is beset with another layer of management. The right hand rarely knows what the left hand is doing because of the enormous level of bureaucracy. And that's why there are repeated breakdowns in the system which are costing the lives of our most vulnerable and saddling the state with millions of dollars in lawsuits and settlements. The new DSHS secretary says she's trying to fix the system, and I applaud her for her efforts. However, well-intentioned efforts by other secretaries in past years to reform DSHS have historically made little difference. On average, a new secretary is appointed to DSHS about every 22 months. Mismanagement deep within continues to outlast the tenure of DSHS secretaries, and that demonstrates the problem cannot be solved by one individual. It's much larger than that. So, what is the solution? I believe we need an entire restructuring of DSHS from top to bottom. It is why I have co-sponsored Representative Armstrong's House Bill 2197. This is a bill that would reform DSHS and break it into smaller, more manageable, and accountable agencies. The measure has passed 3 House committees, including the House Health and Human Services Appropriations Committee, where I serve as a member. So I've already had one opportunity to vote on the measure, and I'm looking forward to a second opportunity on the floor. As a part of the restructuring, the new Department of Children's Services would become operational in July of 2011. By July 2012, the 3 new smaller departments of Economic Services, Medical Assistance, and Health and Rehabilitative Services would become operational. The measure would create a realignment team to oversee the new structure of DSHS. Right now, DSHS is so large that it has published a booklet called Navigating DSHS. Isn't it a shame that we have an agency so large that citizens need a roadmap to get through it? By creating smaller agencies and eliminating layers of bureaucracy, I believe the state can finally begin to deliver better, responsive services that protect the lives of our most vulnerable. The death of children and our elderly under DSHS are completely inexcusable. It's time we fix this problem. We owe it to the innocent and the most vulnerable citizens among us. As always, I appreciate your comments on this or other state issues. You'll find my office phone number on your screen. Thank you again for joining me on Legislative Update. I'm your State Representative, Norm Johnson.